Menya sure some Mumbia hospital this week.
Debbie.
Dogon hospital.
Debbie. But my share footage is in the Bibre. And a year ago, so on my Yami Australian. And your population grand also.
Yes.
And also, when you are. Share Mammy Mao example, case study. Australia.
Okay.
You know, more population, almost the same. Share more healthcare system now. When you are free for all citizens.
Wow.
Yes, even green card holders can. Free healthcare. System is working.
Wonderful.
Uba your Chrome Hanuma. Opening be once upon a time the National Health Insurance Levy. Or Capino. Educoje to Obi. Ama your healthcare sector no. Abandoning the knees. When you are we the political actors, right? From both sides, MPP, NDC, we should desist from playing politics with the health of our citizens. Asema atuye dada. I quite remember in 2015, under the leadership of the then former health minister, Honorable Alex Sebefia.
Yes.
There was a strike by Ghana Medical Association. And all doctors were on strike. At the government in the year, the move on year that was very condescending and disrespectful to the medical profession. They say, the doctors, if you Cuba, ebaye. Asama meeting, enyemede. Say, for so long no, your healthcare sector, no, the nurses are part of the backbone or the pillars of our healthcare system, whether they like it or not. There is never smoke without fire. Asembiano, any senior, the solution ba. Ni na ya kro. Mpachotimasi. This health minister, one share goodwill a Ghana for Edema Ora John Dramani Mahama, His Excellency. No, one share na akopim.
But okay, is it not going through the procedure? I mean, systems. Me buy me nya bibisa afina beto menim mabehu de wo professing Ministry of Finance catch me say 2 billion annually. I no shit. Mo hwe na montumi nya hu bibi man ya.
Menua, on say. Yeah, man, yourself there. Sometimes, we eat our own poison. The Americans say, in 2024, during the elections, the climax of the elections, yet the promises are, Obiya. What you say? And you know, sometimes, some political parties who have an advantage of winning the election will ally themselves to various labor unions and organized labor. But ultimately,
yeah.
To incite the public against the incumbent government and to have some leverage. We've seen it all across various elections. What you say? At the very, very climax of the election, we who strike ni nyama koso.
Yeah.
And it's all deliberate. Sisi amwabano. They feel say omuna mwabwa ama waba. Inti prioritize their needs. And that is why I keep on saying, say, we should not play politics with these issues. And we should desist from influencing our organized labor politically. Because it would hit us hard in the future. And this is what is happening today. We'll share some of the commentaries from the NDC now. I'm quite disappointed because, look, you should rather humble yourself in dealing with this matter. Minya, and then Kasano. The nurse to patient ratio in Ghana is about 1 nurse to 1,450 patients.
Wow, too much.
Too much. The WHO benchmark and our standard, they say, nurse biano on share 300 to 500 patients for even our developing countries. But we share the international healthcare standard now. almost say 1 nurse is to 6 patients in terms of inpatient department. Yaba ICU 1 nurse is to 2 patients. Yaba surgical wards 1 nurse is to 4 to 8 patients. The question I ask all of us here and all the political actors, including the technocrats within Ghana Health Service, they say, is this a reality in our healthcare sector? Say, the nurse to patient ratio, I confirm. Our nurses are overburdened. Ushe ye rural areas na chips compound de kika ho na kra na accommodation and nurses for kra bet na money doctors kra ASM. The condition of service is highly repugnant. Nti ye ka asem we ya yem brave ho ase because these people are suffering. People might say I'm biased because I hail from the College of Health Sciences, but it is what it is. But
are you being biased?
I'm not being biased. I'm speaking the truth. And I'll always stand with the doctors, the nurses, and all healthcare personnel in this country. Because they have been patient for far too long. That is why you can see a massive exodus of our healthcare workers. Now, Obibeka said, and one of commentators, they say, Nagana crown nurses no omuye too arrogant. A hungry man is what?
Hungry man.
A hungry man is an angry man. Obi a oye juma ni input no ense ni output no. Ebe de na ni beje. Uwa wotina ha no. A oye ojuma no. Se Kessben anhwe owi a, ube fi se o kasa nkra, I mean, ube kasa ye. Baby un kasa ye. We are all human beings. Enye bo na ehye yem. We are not built by stones. Yeah. We are built. We are flesh and blood. Yeah, human beings. Yeah, our feelings. Your emotions. You know, there me person me catch abayne say. Sure. Let us look beyond politics. Say, mami way, and the leadership has been polarized or influenced by some political actors. Yeah. That is not the matter we are dealing with. What they are crying for, is it going to help them, and is it legitimate? I say yes.
Okay.
Because nurses bebre, mami kancho. Oshe various hospitals, regional hospitals, district, chips compounds in Nana, they work overtime. Obi antu amuka sa kanakra. Omo work overtime. Edu baby kra na nurses, etimi use omo boto musika, editor droma patients, editor gloves. Minya gloves, syringes using in no. And they Meka say aban enhwehwemu impetuously the issue with Ken Ofori-Atta because part of these problems was caused by Ken Ofori-Atta. I know the mechanical.
Same the same.
Now who him say aban is heavily indebted. You've not painted a true picture of the economy or government fiscal position to the people. Now we are negotiation na enkoyi. Now, National Health Insurance Levy, no, Odi Akoje Busia, and you've capped it. Meanwhile, this levy would have gone a long way in helping our healthcare sector. Ken Ofori-Atta should be blamed for this. He should be blamed for this issue as well. And I Mesre Ghana for, Mesre Asofo for, Mesre Imams and the traditional authorities, and they say these are critical moments. I'm on board. So that they can also help the government mitigate this crisis. Meanwhile, Osha pictures now if your hospitals in Bana, a year the mortuaries are recording high rates of mortality because of this strike and nurses are kono. People have argued, say, is it legal for nurses to go on strike? Osha Labor Act now. Essential health care workers and I said providers of essential services are prohibited from going on strike.
Sure.
And it is as a result of the sensitivity of Omu Jumano. Say na unim say your healthcare system enye Juma, we will have a lot of sick people, we will have a lot of mortality, and also the social welfare of our people would go down. There is an epidemic of Mpox.
Yes, Mpox is also
and it's rising.
Echo. Yeah, the vaccine, bad vaccine, basa.
Yeah, Echo. Intinu, the government should humble itself. And I'm calling on your friend is saying all corporate bodies, as a major agent corporate social responsibility policy now omumbobo sika now omun create some welfare fund for our nurses na yentimi hwe say betimi aboabo mo kakra na asemo betimi dey abaye but mame fa wa fidie so and sre nurses for say misromo me wo me magu kotodwe say they should go back for the sake and the love of Ghana. But not the political actors. Now, almost on better media, me not sure say on me call back cry. Miss Romo.
Mate. But I say, Dr. Ramzi Inusah and the Movement for Change.